NLN Pre-Nursing Entrance Exam Study Guide. Question 1. Which second quantity matches a 2:4 ratio when the first quantity is 8 in this grammar check item? Option A 20, option B 16, option C 24, option D 8. The correct answer is option. The first part grew from 2 to 8, so the scale factor is 4. Multiplying the second part, 4 times 4, gives 16, the other values use the total, the first quantity, or an extra scale step instead. Question 2. During a quick next review of a word knowledge item, which word is closest in meaning to sequence in a science paragraph? Option A, chaos. Option B, weight. Option C, order. Option D, texture. The correct answer is option. Sequence means order, so that choice matches the meaning in context. Chaos means disorder, not order, weight means heaviness, not order, and texture means surface feel, not order. Question 3. After checking the choices in a data table item, which answer identifies the process moves water across a semipermeable membrane? Option A, osmosis. Option B, exocytosis. Option C, mitosis. Option D, a transcription. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Exocytosis moves materials out of a cell, mitosis is cell division, and transcription copies DNA information into RNA. Question 4. If a algebra review stem gives one clear clue, which answer best explains the author's point? A patient education sheet used short sentences, headings, and pictures. Option A, clear formatting helps readers understand health information. Option B, pictures make written instructions unnecessary. Option C, headings reduce the value of information. Option D, long paragraphs are best for patient teaching. The correct answer is option. The sheet is designed to improve readability and comprehension. Pictures make written instructions unnecessary, is not supported by the passage, headings reduce the value of information, is not supported by the passage, and long paragraphs are best for patient teaching, is not supported by the passage. Question 5. When time is limited on a heart rhythm question, which increase is shown from Monday 12 to Wednesday 20 in a simple practice chart? Option A 8, option B 32, option C 5, option D 20. The correct answer is option. The increase is the final value minus the starting value, 2012 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a lung function item, which weight in pounds is closest to 50 kilograms using 1 kilogram equals 2.2 pounds? Option A, 52.2 pounds. Option B, 110 pounds. Option C, 22.73 pounds. Option D, 1,100 pounds. The correct answer is option. Multiply kilograms by 2.2, so 50 times 2.2 equals 110 pounds. The other choices divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 7. Suppose a similar digestive process item appears on test day. Which word is closest in meaning to verify in a science paragraph? Option A, confirm. Option B, borrow. Option C, doubt. Option D, hide. The correct answer is option. Verify means confirm, so that choice matches the meaning in context. Borrow means take temporarily, not confirm. Doubt means question, not confirm. And hide means conceal, not confirm. Question 8. While working through a timed homeostasis set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, villi. Option B, nephrons. Option C, bronchi. Option D, alveoli. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Villi absorb nutrients in the intestine, nephrons filter blood in kidneys, and bronchi carry air toward the lungs. Question 9. Before choosing an answer in a scientific method item, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A, orientation should never include stories. Option B, former patients stopped the program. Option C, personal stories can motivate people to participate. Option D, volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Orientation should never include stories, is not supported by the passage. Former patients stop the program, is not supported by the passage, and volunteer programs grow without communication, is not supported by the passage. Question 10. A student sees this control group idea on a next review. Which answer identifies the group that does not receive the experimental treatment? Option A, a control group. Option B, sample. Option C, experimental group. Option D, a conclusion. The correct answer is option. A control group provides a comparison for the treatment group. Sample is the participants or items studied, experimental group receives the treatment, and conclusion is the final interpretation. Question 11. One sample size practice problem tests the skill. Which number is 40% of 250? Option A, 290. Option B, 1000. Option C, 210. Option D, 100. The correct answer is option. 40% means 40/100, so 250 times 40/100 equals 100. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 12. Several choices look tempting in an enzyme activity item. Which word is closest in meaning to adequate in a study guide note? Option A, hostile. Option B, ancient. Option C, empty. Option D, sufficient. The correct answer is option. Adequate means sufficient, so that choice matches the meaning in context. Hostile means unfriendly, not enough. Ancient means very old, not enough. And empty means lacking contents, not enough. Question 13. For this pH scale nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A, antibody. Option B, platelet. Option C, hormone. Option D, enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Antibody targets antigens, platelet helps clotting, and enzyme speeds chemical reactions. Question 14. In a short solution chemistry practice STEM, which answer best explains the author's point? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, quiet rooms increase noise. Option C, reducing distractions can improve study conditions. Option D, distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage, quiet rooms increase noise is not supported by the passage, and distractions are always helpful is not supported by the passage. Question 15. Among the choices in a genetics clue item, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A. The policy must be ignored. Option B, graphs cannot show patterns. Option C. The graph shows a possible association but does not prove causation by itself. Option D. A rising graph proves the policy caused everything. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. The policy must be ignored does not follow from the situation, graphs cannot show patterns does not follow from the situation, and a rising graph proves the policy caused everything does not follow from the situation. Question 16. Using the facts in a cell division question, which probability describes drawing a red card from a set with 5 red and 4 blue cards? Option A, 4/9. Option B, 9/5. Option C, 5/4. Option D, 5/9. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 5/9, simplified to 5/9. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 17. Based on the clue in a bone support item, which word is closest in meaning to beneficial in a study guide note? Option A, drowsy. Option B, ordinary. Option C, harmful. Option D, helpful. The correct answer is option. Beneficial means helpful, so that choice matches the meaning in context. Drowsy means sleepy, not helpful. Ordinary means common, not helpful. And harmful means damaging, not helpful. Question 18. Consider this high-yield muscle movement concept. Which answer identifies the cell division that produces gametes? Option A, mitosis. Option B, translation. Option C, diffusion. Option D, meiosis. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Mitosis produces identical body cells, translation builds proteins, and diffusion moves particles down a gradient. Question 19. Near the end of a nerve signal review session, which answer best explains the author's point? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, a training may have improved compliance with hygiene practices. Option B, hand hygiene cannot affect infection. Option C, a training increased infection rates. Option D, the refresher removed all risk permanently. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection, is not supported by the passage. Training increased infection rates, is not supported by the passage. And the refresher removed all risk permanently, is not supported by the passage. Question 20. Across similar endocrine message nursing entrance questions, which increase is shown from Monday 19 to Wednesday 29 in a simple practice chart? Option A, 48. Option B, 10. Option C, 29. Option D is 7. The correct answer is option. The increase is the final value minus the starting value, 2919 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the glucose regulation clue, which milliliter amount equals 0.5 L? Option A, 50 ml. Option B, 5 ml. Option C, 5000 ml. Option D, 500 ml. The correct answer is option. 1 liter equals 1000 ml, so 0.5 times 1000 equals 500 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 22. From the information in a chart reading item, which word is closest in meaning to comply in a study guide note? Option A, obey. Option B, refuse. Option C, describe. Option D, wander. The correct answer is option. Comply means obey, so that choice matches the meaning in context. Refuse means decline, not obey. Describe means tell about, not obey. And wander means move around, not obey. Question 23. At a testing desk during a ratio setup review, which answer identifies the solution with pH above 7? Option A, hypotonic. Option B, neutral. Option C, basic. Option D, acidic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Hypotonic describes lower solute concentration, neutral describes pH 7, and acidic describes pH below 7. Question 24. Inside a unit conversion science or skills item, which answer best explains the author's point? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, patients cannot benefit from reminders. Option C, appointments no longer need scheduling. Option D, reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits, is not supported by the passage. Patients cannot benefit from reminders, is not supported by the passage. And appointments no longer need scheduling, is not supported by the passage. Question 25. Through careful reading of a percentage item stem, which answer identifies the transfer of heat through direct contact? Option A, evaporation. Option B, radiation. Option C, convection. Option D, conduction. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, radiation transfers energy by waves, and convection moves heat through fluid circulation.